You're listening to Runions Have Layers, the podcast where two siblings explore the many layers of life and mental wellness, where vulnerability meets strength and where every shared story is a step towards self-discovery. Join us as we uncover the richness of our experiences and find empowerment in every layer.
Welcome back, everyone. Today we're going to be talking about men's health and redefining masculinity. Today, Brian Rayburn is with us, who is one of my best friends in the whole world and a physician's assistant who is extensively educated on men's health topics. He holds a Master of Science and is a practicing men's health urology physician's assistant at Arkansas's only academic medical center. His primary focus includes erectile dysfunction, testosterone therapy, infertility, and sexual dysfunction, among many others. So let's start off by talking about what you do as a physician's assistant, Brian, and why men's health is an important topic to be discussing today.
So as a PA, I think it's important to say that, PAs and even nurse practitioners were masters or doctorate trained in the medical field. So although we're not residency trained in a particular specialty, we are very generally trained. And a lot of extra training comes from on the job and through conferences and discussions and after graduate, just continuing education. So in men's health, I've been doing this for almost 2 years now. I got into it after working in urgent care and just seeing a lot of issues that weren't being discussed properly or being treated, or even just asking the question of like, why aren't we addressing these issues? And so as a PA in a surgical specialty, my job is really patient education. I do diagnose and treat issues, but also like post-op follow-ups and just making sure that the complete care is taken for these patients. So the surgeons are MDs, DOs, they get to surgically fix you. I get to do the medicine and the education.
So would you say that most of the time when someone goes to see a doctor that they are probably talking to a PA, or does it depend on what they're going to see a doctor for?
I think it depends on what state you're in. Arkansas is definitely on the up and up, but we're at the bottom of the list. Thank God for Mississippi. But more often than not, it is becoming more likely that most of your care would probably become from what we call an advanced practice provider, like a PA or a nurse practitioner. In my role, and I think this is a pretty common kind of protocol, if I'm seeing you every 3 months for something, I might see you 3 out of 4 quarters, and then once a year, you're going to make sure that the doc is checking in. And that's pretty standard. That allows new patients to get in the door and start treatment faster with the physicians. And then it helps us kind of continue the care. And if things change, then I have the doctor to go to.
Yeah, and I don't think I actually knew that until you became a PA. Brian and I have been friends for a long time, and so I've seen and observed his journey throughout all of this. And before you became a PA, that wasn't something that I was really aware of. And so that was kind of surprising that, whenever I go to see a doctor, like, not that you're not qualified, because obviously you've been through all of this education and that you practice on a regular basis. But I think a lot of people assume that when they go see someone that it's like a doctor, quote unquote, that someone who's, like you're saying, has gone through the residency. So for me, that was a new thing. Can you give a little bit of context of why you think mental health is an important topic to be discussing with the practice that you do every day? And is it talked about whenever you're practicing on a daily basis, or how does it come up whenever you're seeing a patient?
Yeah, I think, it's important to point out that I work even more specialized in the men's health role in urology. So a lot of my issues are really coming from probably sexual distress. And to throw some light humor on it, every guy adds 2 inches to his penis when they're talking about their penis problem. Every guy thinks, oh, I've lost this or I'm not doing this. I'm not the man I used to be anymore. And a lot of those guys start saying that around age 40 or higher. And then you got to really start thinking about it too. Well, if we fix this or we find a way to improve this, what happens? Do you not become so body dysmorphic anymore? What can we do to help you also be happy with, and I guess happy with the boat that you're in? Kind of tell guys, we're all in a separate boat. This is the boat you're in, but let's figure out how to keep you afloat and make your boat better.
We're going to need a bigger boat.
Yeah. But no, I mean, a lot of these issues. So, body dysmorphia, there's, really high risk stress inducing issues when we talk about urological issues, incontinence, urinary issues, all kinds of things.
Yeah, I think you bring up a great point, which you said, I'm not the man I used to be, is something that you might hear from people. And I think the language that we use, like in a masculine setting, and where does that come from? Like how are we taught that, and where do we learn that? And it's like we don't even necessarily think about it in that way, but we are like trying to sort of man up in a sort of way, which is, I feel like, another saying that I heard a lot growing up was, like about not crying, like man up and just, get back on the field and go play the game or whatever. I feel like that was like a very masculine type of response in like the language that we were used, typically from coaches or from teachers or friends or brothers or father figures, whatever. I mean, personally, I feel like it really stems from like religious standpoint. I feel like there's a big, and just everything in general. We talked about this in our previous podcast about body image and how a lot of what we learn comes from religion, and how that is how it's passed down and sort of dictates all the other areas that we deal with in life. And that could be different laws that are made, or healthcare, and what was the thing we talked about, Holly? How it was a medical thing that someone came up with.
Well, BMI.
Yeah, we talked about the BMI and how it was a straight white man that came up with that, and it became like
the standard.
Yeah, and I think that's a perfect example of just a piece of kind of what I'm talking about. But like the language that we learn from a really young age that has perpetuated through decades and centuries of like masculine type of ideology.
Yeah, I mean, I guess if you want to kind of dive more deep into that, right? They say like, oh, you have the toxic man, right? You've got these, you should be a bully, you should be defensive, protective, you must reproduce and be fruitful.
Mm-hmm. Yeah, and even growing up, I remember hearing whenever I was like, probably even before I went into puberty, about interacting with girls. And it was like, you have to be mean to girls to get them to like you. I remember that on multiple occasions, people told me that. And I observed that too. That was something that I was like, this is fucked up. Why are people being told that this is how it's supposed to be?
Yeah, he pushed me down. Oh, he must like you, sweetie.
Yeah, exactly. And exactly, like the parents and the teachers kind of reinforce that because that's what they heard. Or that's whether it's true or not, and whether they say that in a joking manner, I think that kids take that on in a very serious way, and they see that as like how the world works. And at that age, we're learning how the world works and we're putting it together piece by piece. So I think that, if you're a parent or if you're a teacher or someone that is interacting with a child in that sort of way, I think it's important to consider what we say and how we say it, because they're little sponges walking around and they're just picking everything up. And even if you're joking about it and you say it sarcastically, to us, it's sarcastic, but to them, it's fact.
That also informs a lot of how women stay in abusive relationships, because they learn that growing up, that if, a guy picks on you, that they like you or they love you or whatever. And that was continually reinforced over and over. And I'm not saying that's true for everybody, but it is true for some people.
Yeah. And gosh, to throw myself under the bus, I'm definitely not perfect. And I have a 4-year-old and a 2-year-old daughter, and they can frustrate the hell out of me. And, you get a little impatient or something sometimes, and then you got to think about, well, what kind of man do I want my daughter to be with? And so I have to try to think about like, okay, I'm my daughter's dad, but I should also try to date her too, and like do the nice things that I want her to look for in a man when she's older. And that's a little bit different because like when we grew up, our parents, our dad was the worker and our mom stayed at home. We had to be dominant, make decisions, be the one income household, and those are just a lot of stress now for people, but it also put women in a place where they, what was it? Home ec, right?
Yeah.
Yeah.
Teach you how to bake and stay at home and do these things and obey your husband and cook for him and clean. And
we had home ec up until I think it was like 9th grade. At least I was in 9th grade, I think was the last time they offered it. And so they had home ec even all the way up until that point, at least in Arkansas. So I agree. I think that how society is really teaching us how to do those things puts this mindset, Holly and I both had a mom that was a stay-at-home mom for 15 years, 12 or 15 years.
Yeah.
And she did that a long time. And the only reason she had to stop doing that was because my dad wasn't making enough money anymore. He had a job change and we moved across the country, and he wasn't able to be the sole provider just solely based on where we were. So we had a similar upbringing as well. And my mom loved it. Like, my mom's a baby boomer, and she's told me multiple times, that's all she ever wanted to do was be a stay-at-home mom and be a mom. And because that was what she was taught and that's what she was fed. And not to say that's wrong. I'm not trying to say that, because I think that if someone can stay home and take care of their kids and be a provider to their kids, there's value in that. I don't think there's only value in someone going to work to earn money. I think there's value that you can add to society in a bunch of different ways. So I'm not trying to say that there's not value in that, but in terms of like the gender roles that were played in America specifically, it's very much like the woman is the submissive servant, quote unquote, so to speak. And the man is the one who's dominating everything else and makes all the decisions of where they're going to eat and what they're going to do for dinner. And I don't know, when we're going to have sex and just like everything. And I think it's changing with like generation by generation. I think there's more and more of that going away. But some of it, honestly, is by necessity. Like, because inflation is rising and cost of living is rising and wages are not following that trend. More and more people are having to go to work. And we've seen that since, 70s and 80s, beyond the sexual revolution, and how people wanted to be more independent and wanted to be more of an individual than having to depend on someone. But as all of that started rising, it became a necessity where it's like, I have to work in order to pay my rent and to pay my bills. And I think that just carried over into where we are now. So I don't necessarily think like the mind state and the way we think about those things have necessarily changed.
There's a lot of role reversal now too.
Yeah, absolutely.
So you think about it. So in healthcare, I think that I want to say that just in med schools, I'm pretty sure there's more women than male becoming doctors now. You're talking about someone who's going to spend 13 years of their life or more, or maybe just slightly less, and come out and they're going to be a top 1%er, right? But then she is also the one that's going to have a baby, right? She's going to do these things and she's going to expect it to also stay at home with that baby and those things. But she's in a role in society now where she has like people's lives depending on her, not just her own offspring and her children. She's probably going to find, if she doesn't marry another doctor, she'll probably find a man that is very comfortable, maybe has a job from home, that can stay and help provide for her and do those things that she does not have the time to do. And there's no way in hell that would have happened 40 years ago.
Yeah. And even if she doesn't, like if this imaginary person we're talking about, she becomes a successful doctor and she is maybe the sole earner / the top earner in her family, there's still going to be an expectation from her job, by people around her, possibly her spouse, who is expecting her to rear the child and to give them a bath and to prepare breakfast and take them to school and help them with homework. I feel like there's still a lot of that baked into the expectations that society will expect of her, even though she has proven that I'm successful, I'm smart, and I am doing way better than my counterparts. I feel like there's still this expectation because she is a woman and she had the child, and it's like, well, you're the mom, like that's your job. And so I think that is an important thing to say and to bring up. Holly, what do you have to say? Because I feel like that's something that you can chime in on.
As a woman.
Right. This reminds me of a quote that I heard. I don't remember who it's from, but society expects women to be an employee like they don't have a family or children, and be a mom and a wife like they don't have a job.
Oh, that's good.
And it's like our attentions are always divided, and, the job wants us to be there 100%. Family wants us to be there 100%. And it's like, we have to be a million different people and wear a whole bunch of different hats. And, it's hard.
Yeah, my wife is a nurse practitioner, and I will tell you that she was raised very independently. Her older sister's older by like 7 or 8, 9 years, something like that. And her next younger below her is 6 years. maybe. So she kind of grew up on her own. So she's very independent. She definitely does not need a man. And she'd be totally fine on her own. She does great. She does all the things. Myself, I'm a good supporter. You know, it's good though. I think that the way that society is having expectations on men, and we're starting to not be so scared to talk about things and have more, I guess, self-love and notice these things. But then there's a lot of men, especially like our fathers, who are not brought up that way. Or gosh, I don't know, I'd say my father, but he's like 60, I guess maybe 15 years older in our group, 45, 50-year-olds. These are guys who probably a little more risky or are in that semi-toxic dominant role, and they don't want to go seek healthcare. They don't do it. They go when something's not working. In my field, that's usually their penis.
Yeah, I talk a little bit about like the very unique position you are in, because you've told me some stories that I think are interesting to mention about, like what you said, like they go see a doctor when something's not working, but any other time they're not going to go see the doctor. So you're like in a very unique position to check kind of everything and give a good once over on when they come in, because they may not come in again, or they may have not been in for 10 years or whatever, but they're in now because they need to talk to you about their penis. So like, can you talk a little like about how that's unique and how do you approach that?
Yeah. So, when I have this guy comes in and he says, look, I'm just not getting the same erections. My wife and our sex life is decreasing. It's even worse for me because now I'm in this cycle, essentially I'm thinking about my penis not working, and then my penis isn't working. So then I'm thinking about it. And it's this vicious cycle. And you ask him, you say, let's just say this is a 50-year-old, let's say white male. And you ask him, well, do you have a primary care doctor? I do. When's the last time you saw him? I don't know. When I was like 40 for a physical, I got a finger up the bum from him, and, he did a couple things and he said everything looked good. So everything looked good. Why go back? There's a lot of reasons. Men are more subjective to these risky behaviors, increased alcohol consumption. We're more likely to go eat fast food on the way home than females. There's a lot of behaviors there that aren't necessarily taught, but men just don't give a shit about. And then you have the same guy that comes in and he's, like we said, we're saying his penis doesn't work. The main thing I'm thinking about is it nerve related, blood related, or is it all in your head? And some of those topics lead out to nerve related. Well, diabetes, or he's a construction worker and his back hurts and he's having this kind of neuropathy there. But either way, when these guys are eating very poor and they're not taking care of themselves, they're not exercising, their heart rates aren't going up, they're not doing these things that they need to be doing, and their sugars are going to affect their nerves. That can decrease their erections. You have to have blood flow down there. You have to have your nervous system has to be functioning well, and you have to have hormones, and something is going off. This is a guy that hadn't been seen in 10 years. So I want to check his sugars. Not really going to do a full cardiac workup. That's not my job. But I do know that, I'm thinking, well, this is a 50-year-old white male. Statistically, this is the guy that's going to have a heart attack and it's not going to go no. So how long has his erection not been working? 5 years. Okay. Well, gosh, that's 5 years where you're telling me your blood flow has sucked or something has sucked and something's not functioning as it should. Maybe you should go see a cardiologist, because then we have to think about things like atherosclerosis or plaque buildup in your arteries. What if that's in your heart? And then you become a widowmaker and you've left behind 3 teenage kids and a wife and all these things. These are things that in men's health, we have the opportunity to kind of seize upon and do these screenings, because they're going to come back. They never forget the guy that made them happy, so to speak, in bed, right? Like we become their wife's next favorite man. Like we're so glad, this is great. But then I have the opportunity to bring these things up. Like, look, I really think you need to go see a heart doctor. We know there's a high prevalence within 5 years that you're at risk of having a heart attack, a major cardiac event that's going to change your life. You need to go see someone. Like this is severe. This isn't something that just a pill is going to fix. I'm still going to give them a pill because I want them to have the erection, but I also want them to go figure out what the underlying cause is.
How many of your patients do you think is it's a physical issue versus a mental?
I don't know necessarily about how many of my patients. I think it's more of an age range, right? So I'm going to kind of categorize like, let's say 20 to 40 and then 40 to 60 and then 60 to 90. Okay. If I have a 20 to 40 guy that comes in, especially even closer to 20, and he's telling me this is happening. Well, I might not be thinking about heart attacks or those things going on. I might be thinking about, is this drug related? Is this performance anxiety, past trauma? Now you've got a guy, he's out of the house, he's trying to be sexually active. He's got the social media behind him saying, hey, you know, I don't even know these things because this is out of my age range at this point. It makes me feel old. But what is it, like Hinge and Bumble and all these things, right?
Yeah, dating apps.
Hookup apps, you know, essentially.
Yeah.
And so there's a lot of performance stuff there. You're not intimate with someone. You're just there to have sex with them, you know, or you're drinking too much. You can't get an erection, you know, all these things that are there versus the 70-year-old. Well, if you know anything about Western medicine, a 70-year-old guy probably has a list of 30 medications he's on by 10 different doctors. 50% of them probably have a high prevalence of his penis not working. And that plays a huge role. Not to mention our testosterone's declining after like age 40, age 45, it starts to really dip down. That plays a mental role. But there's a lot there. But yeah, I think it's more of an age group issue. So 60 to 70, we're either treating something or we're going to play a lot of catch up and try to figure out what's going on. Mid-range, maybe it's something starting and we need to like really get your focus on that. But I think the younger age is really where I'm going to consider that more of a mental.
Would you say that things that you encounter like erectile dysfunction is a side effect of these major medical issues and you're kind of potentially catching something like a heart attack because this is like it's eventually, or it's finally reached this side effect that it's affecting their penis. And it's like, now it's like a super serious issue if it is something like that.
Yeah, it could be. You know, we kind of talked about diabetes and things, and we're going to go through the screening process. And I might tell them you haven't had these labs in a long time. I'd like to know what these labs are. I want to know how your kidneys are functioning. I already got your blood pressure. Your blood pressure looks fine. There's some like general tools there, but some labs are going to tell me a lot of things too. Your cholesterol, your blood sugar, your A1C, all these things. But you kind of made me think about a patient I had not too long ago. He was like upper 30s, mixed male. I think he was Indian with Caucasian, something, you know, not doesn't necessarily matter, but very muscular guy. He'd been using anabolic steroids since he was like early 20s, completely doing it the wrong way. Not that there's a right way. It's illegal to do that, but he never stopped. So you hear about these cycle, I'm doing some kind of cycle, blah, 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 of steroids to build muscle and stuff. Well, these things kind of inhibit your blood sugars. They raise your cholesterol very bad. They're not safe overall to do. If you have a provider to help mitigate, sure, maybe, but they're still not safe. He was telling me, guess what he came in the clinic for?
ED.
His dick wasn't working. We're talking to him. And he says, man, he's like, I'll be honest, I've done these anabolic steroids. My body looks great, but I don't feel great. What do you mean? He's like, well, I'm trying to increase my cardio, but I'm having chest pain. I'm like, okay, is this like chest pain when you go run out in the cold? Or are you like legit shorter breath? You have to stop and your chest hurt. And he's like, no, it's the left side of my chest. I get tingly, like I get anxious, all the signs that his body is telling him something's going on. I'm like, hey, this isn't good. I don't have the tools here, but this is a guy that needs to go see the cardiologist. He came back about 2 months later for a follow-up and he had 3 stents placed in his heart and he had 90% blockage in his heart. He's 38. He was like this close to like not waking up from his sleep or something, you know?
Wow.
And he hadn't seen a doctor in forever.
And he was still pretty young.
Yeah. Not much older than us. So that's a very defining moment. Like, oh man, I wasn't super sure, but like, I'm so glad we caught this. And then his wife comes in with him too, you know, it's like, I don't know what you did, but I'm glad you caught this, you know, but that's risky behavior, you know, social media is telling this guy or The Rock, all these movie actors that are getting huge, like Hugh Jackman for the Wolverine. He'll tell you, if you hear anyone in Hollywood say chicken and rice diet, no, it's not just chicken and rice. Someone's paying lots of money for them to get ripped, to get jacked, right? To look like your common male. This is the male figure, you know,
really quickly.
And so I guess it's almost more like a McDonaldization. There's definitely things to catch there that just off that one simple thing, you know, we've talked about all these things that are already going through my mind or the urologist's mind when they see that. Sometimes we don't always address it, all that stuff, but we're thinking about it.
Yeah. And I think that's a good opportunity for not only you, but for them to see that what they're encountering is connected to everything else that they're experiencing in their health and that they're not eating right or they're not exercising. It's having an impact that is making their quality of life go down. essentially, you know,
Mhm.
and that the ability to feel pleasure and have pleasure is taken away because of all these other things that have built up for over years. And hopefully that is a wake up call, so to speak, for them to where they're like, okay, now I need to maybe, you know, pay more attention to these things because it's going to affect everything, and everything has an effect based on how I, you know, how I treat myself and my body and all that sort of stuff.
And then, you know, I guess I could throw a plug in too, where, you know, I do a lot of testosterone therapy, and there's a lot of controversy around that. And, you know, ED is part of there. So that's something else I'm going to think of. But there are a lot of studies that show like anxiety and depression, even from a mental health aspect, are affected by our hormones. I mean, really, I mean, this is what it should be, right? Like
Yeah.
our hormones elevate us. They should motivate us. They should do these things. And there are a lot of guys being treated for depression that their doc just hasn't really screened them properly. You know, they fill out a questionnaire that's questions, you know, do you find a lot of joy in your day? Do you feel tired? You do all these things. You know, have you ever thought about suicide or whatever? Which is another risky behavior that men have. And you ask them these things, and you're like, well, did they ever talk to you about maybe checking your testosterone? You know, you're telling me, sure, there's some depressive symptoms there, but there's also signs that there may be a hormone imbalance there too. And then we start screening them for those things too. Say you start treatment for them and you bring them back, and they're starting to have these, I'm not feeling so tired in the afternoon anymore, or maybe I'm thinking about sex more, or, you know, that project in the backyard I haven't been motivated to do, finished it in a week. Like I just didn't want to stop doing it. These are things that are very a simple screening tool or screening labs catch, and it can be, you know, really change the quality of life.
I know that with lab values, they're there for a reason, but since everybody's different, everybody reacts differently to medicine and hormones and things like that. So what do you do in a situation where somebody's labs come back and they're normal? I know you look for other things, but do you consider hormone therapy to get them to a more optimal level? Like if it's a low normal?
You said a good word there. Optimal or optimizing is becoming kind of like a fad trend, right? Like, come to our clinic, we're going to optimize you. And really what they mean is, and I'll dig just a little bit deeper into it, but what they really mean is some of these symptoms could be related to you being on a lower normal spectrum. We would like to do stuff, treat you, you know, try these things out. There's peptides, all kinds of whatever, to get you to that higher normal and optimize you, you know. It's like a gas tank or something, you know, like how are you going to feel? How's your car feel when the gas light's on versus when you have 3/4 of a tank? It's going to feel a lot better and more responsive. And, you know, I think that's kind of what you're asking. You know, I'm in an academic center. I'm 99.9% of the time going to go by the book, or I'm going to have discussions with the doctors I work with, say, look, this guy he's on the low end of normal for, let's just say, his testosterone, and he's having symptoms. Guidelines are there to say, you know, this could be something we consider like subclinical, and that could be anything, thyroid, all these things. That's when you just have a good conversation with the patient. You know, you can try a trial of therapy, right? And he comes back and says, oh, this is working great. Or even the females that I treat with for hormone therapy, you know, I don't want to stop. I've never felt this great. Okay, then I think a lot of this probably was that, but I don't want to mask some things too, you know? So talking about low end of normal. So what else could cause that? You know, sleep apnea, you're not getting good sleep, that can raise your cortisol levels, high stress job, cortisol in particular, when anyone is really stressed, that can have kind of a inhibitory effect on production of hormones. So your body's always in this constant flux. So making sure you're taking care of it, you know, sleep hygiene. If you have sleep apnea, you need to have a CPAP machine. You need the oxygen. Your body's starving for it when you're sleeping. Vitamin D. How many people are vitamin D deficient now?
I just read a statistic that said 77% of people in America.
Oh, yeah. Well, you know, what about this oat milk and cashew milk and all this stuff? You know, are they fortifying that like they were with milk with vitamin D? Do they need to start doing that better? Everyone's wanting to be healthy. So you go buy your oat milk and things, and those don't have all the nutrients that you need, or at least we're not caught up to the point where I want to buy an $8 half gallon of milk.
Yeah, not wrong. Yeah, I think what you're bringing up is, I mean, it's all connected, but moving on a little bit beyond the actual health care, I know it's all connected to the health and how we're taking care of ourselves and how we're approaching just taking care of our bodies. You mentioned going to work and like being stressed and cortisol levels and things. And I think that highlighting the system that we are in America, which is capitalism, and how much that we are pushed to our brink in terms of working hours and working from home, and like the lines have become a lot more blurred than they ever have been. But I think that has an impact on our health, which affects the idea of masculinity. But I also think that just talking about the role that we play as males in society, and like, I guess, sort of redefining what that is. We talked about this example female doctor and how, she's the sole provider. How does that impact her partner's sense of masculinity? Does it, depending on who it is? And how does, whenever we're put under so much stress that we have to go to work and we have to work 60 hours a week in order to pay bills that we can't afford, because everything is super high, and not feeling or not being taught that going to the doctor is okay, and that it's not some sort of shameful thing to do. Like, all these things really, I think, play so much into the decisions that we make within our lives and how they affect each other, that we can't just talk about one, and we are talking about all of them. But I just want to highlight that it's more, I think there's all these factors that are playing into, how we treat ourselves, essentially.
I like kind of paint by numbers. So I'd really like to see how these guys operate whenever they're on Wall Street. New Yorkers work so many hours a week. I mean, they have to, or else they can't live.
Yep.
But let's go to a rural city where they actually, they a middle house income, and they're having an okay life, and they're working 40 hours a week. Like, what is that quality of life there? Like, what is their stress like? What are all these things they're like, There's so many things that play into the how you feel as a man, Do you love your wife and you're totally happy to support her because that's our society now, and women are more educated and roles are reversing, so to speak, or maybe they're as they should have been the whole time?
Is there anything outside of the survey that gives you any sense of what else they might be dealing with outside of whatever they're coming in to talk to you about?
I don't know. I really try to live by this kind of like men's health / primary care / I'm also in urology. So if you have a kidney stone, we'll help you. But once you open up doors talking to a patient, and you get them a little more vulnerable, they're going to bring things up, I think the more you talk to someone too, you catch up on it, right? Like, when your friend's not doing so, like, you talk to them and something's off. Maybe it's not the first visit or the second visit, but you have this provider patient relationship now, and man, you don't seem the same. What's going on? Man, my house burned down and I'm like super stressed out about it. And this is just the worst thing that's ever happened in my life. Terrible thing that just happened, So those are things you can kind of pick up on. I don't think we're always just asking the question because we're not we're not psychologists or therapists, but I'm definitely thinking about those things for my patients. Lifestyle changes, or, divorce rates are so high. Like, how many of them are going through a divorce and crazy sad about it? These are all things that, like, I want to screen for. And if it comes down to it, even though I work in urology, which is a whole different head and brain system, I might offer to treat them and give them some resources, like, hey, I'm not the exact guy you need to talk to, but like, there's websites. You can do all this from home. You can go talk about these things, and then you got to come up. I can't do that. I'm a man. Like, I'm cool. I'll get through it.
Mm-hmm.
This is just a thing. I won't talk about it, but I'll go to work with a smile on my face. Like, no, you really should. Like, no one's judging you here. No one's doing these things. Like, go talk about this. Mm-hmm. You'll feel better. You'll do better.
Yeah, there's no shame in talking to someone about it.
Yeah, I mean, back then there was. You maybe that's why our parents came home to a beer and whatever. They want to sit on the couch and have a beer and not talk about how their day went. Mm-hmm. But I think that's probably the biggest thing, is talking. And I've had some very intense conversations with patients that have told me that they've thought about committing suicide because of some of their issues. I've had a patient committed suicide because he couldn't have sex anymore. And in Arkansas, that is I don't know the exact term, but that's a non-debatable reason for a woman to leave you. She can file divorce because of impotence. No contest. You cannot provide for me as a man. See? Like, as a man, quote unquote.
Yeah, quote unquote, yeah.
But it's okay if she's gone through menopause and she doesn't have that libido or the drive anymore. You can't, it's not the same. It's not, that part right there is not equal at all. At least where I'm at.
I'm glad you brought that up, because I wanted to ask how, I know that men's health now is being more talked about, but like on my side, on the female side, I hit perimenopause at, I think, 37, but the doctors that see me are like, "Oh, you're too young. That can't possibly be perimenopause." And I had to go to a hormone clinic to get care because my doctor wouldn't give me any medication. So I'm curious how, when you're treating men, if that also becomes an issue with age. It sounds like from what you said, it doesn't, because you see men that are, in their 20s. But I don't know why there's the disconnect there, between men and women.
I don't know. I mean, I think talking about these issues is, let's go back to the talking about it, like men have a very similar thing. Our testicles are made to make sperm and reproduce, and they make our considerably male hormone, testosterone. Females make testosterone almost the same rate as men, I think. But they convert it to estrogen. That's your primary hormone, estrogen, progesterone. But when a man starts to shut down, I don't know why a woman got menopause, but really it should be that men are going into menopause and women are going into woman pause. I don't know, whatever, man pause and woman pause. But it's essentially the same thing. And men go through that: hair loss, depression, fatigue, all these things. Like, think about your perimenopause. Like, did you think about sex? Did you have motivation? You wanted to sleep all the time? All these things. And men go through that too, but they're just scared to talk about it. But now you turn on your TV and you've got supplements out there promoting increase your testosterone, feel 20 again.
Yeah, even on social media, they've got the Hims website now and the Hers website where they have all these different products and stuff that you can buy, ED, condoms, whatever, different types of like health products that are being promoted on Instagram and TikTok and everywhere now.
Yeah, I kind of have a love-hate because you're increasing, those companies are increasing, but they're like subscription services, right? So, you're paying a fee, you're overpaying for medicine that you can probably get a coupon for through a retail pharmacy that should be really cheap. And so I think in some way they're exploiting these things, and they're talking about optimizing, and they're trying to do these low T clinics everywhere. They're a factory. If I had a Molotov cocktail for everyone I saw, they'd all be burned down. They just don't do things the right way. They're hurting people, I think, more than having them feel good. And they're doing it for the financial and the fear mongering and the manlyhood part of it, not just for better overall quality of life.
And they're not addressing the actual root of the cause. They're just addressing whatever they're coming in for. They're not like looking at the whole picture and saying, "Oh, let's look at this piece because there's something going on here." They're just like, "Oh, you want a pill? Here you go."
Or, hey man, I'm not feeling the motivation and stuff I should. Oh, well, let's make you feel like The Rock then, let's give you way too much. It's way outside of the guidelines for this type of therapy. And let's put you in harm's way instead of just talking to you. Well, maybe something else is going on.
So you talked about talking about these things. Do you have any resources that you could suggest? I know there's things like BetterHelp and Talkspace, which are I think widely known, but is there anything else that you've heard of or that you feel like is something you share with your patients on, if they want to talk to someone that maybe is a little bit more confidential or whatever?
I've sent a lot of people to those. Talkspace, I think, is pretty cool. It's kind of like a blog. Like, it's just this open, random, completely anonymous forum, and you're getting the social media like feedback, oh, I've tried this or had this medicine and this sucked. Or like, man, what does everyone do to cope with these issues? Those are all really cool things. BetterHealth, there's one that I like. It's called mantherapy.org. It is like the definition of everything we were kind of talking about, right? But in this new way. Was it like the Jack Links, right? Those commercials are funny. Or there's the man groomers, Manscaped or whatever. Like, man, those are funny, so they're bringing up topics that are sensitive, but in a way you can do it. So like they have like a head inspection, or, you go in there, you pick like, what's the issue? Substance abuse, suicidal thoughts, trauma, sleep, grief, anger, anxiety, all these things. And you go on there and they provide a lot of resources. You can even search by state. I'm going to go to their website actually real quick. If I type in Arkansas, let's see what kind of like resources pop up.
Is this a tool to help people find physical resources, like where they can go, or is it online, or is it a mixture of both?
It's a mixture. There's veteran help, like for Arkansas, there's veteran help, addiction recovery resources. Here's one. This one fits us very well. Man Up is not the answer. Males everywhere are reluctant to talk about their mental health, right? So, I mean, all this stuff's becoming more popular because I mean, suicide rates are up, substance abuse is up, whether it be alcohol. And I'll tell you, COVID didn't help.
No, it did not.
But I think people also, it did help in some ways because a lot of people got on social media and started expressing their feelings. Like, I've been cooped up with someone for 6 months now. I've not been allowed to leave my house. And I also have a newborn. Man, that sounds so depressing. Like, man, like how many people went through these things, you know, or lost their job during that time, and such a stressful time. And I think it'll be a long time before a lot of people recuperate from their own struggle during that time.
The side effects are still lingering, like just within the economy. And it's still affecting people. It's affecting me for sure.
Yeah, the financial stress for one. I don't know how people survive. It's insane. I make a pretty good living in the healthcare field, and I feel like just going and buying the most minimal amount of groceries. You get 2 bags of stuff, right? And it seems like nothing, and it's $80. You're like, where did this come from? You know, and it's healthy food. Grocery inflation is through the roof right now.
I mean, eggs are crazy high right now. You know, like I've seen them as high as like $10 for a dozen of eggs.
Yeah, they're $10 for 18 eggs, you know, $10.
That's crazy. And I mean, that's not the only thing. Everything is crazy. Like, I mean, I remember when bell peppers were like 30 cents. And I don't mean to be like, oh, back in my day, but like just 4 years ago, you know, they were like 30 cents for like a bell pepper. They're $3.50 now. $3.50. That is insane. I don't even buy them anymore because I don't even think it's worth that. And it's just crazy how much stuff has risen. But I don't want to get off on a different topic altogether. I think to wrap up and conclude what we talked about, and the most important thing that I have heard in this conversation is that we need to talk about the things that we're dealing with, not only as men, but just as humans, and to have some empathy with each other and to like open up conversations. You talked about a lot about how people are opening up, or you're trying to open up conversations with your patients, and you kind of let them talk, and you take whatever information you can gather, and then you can assess and you can determine what next steps are the best thing to do. Talk about like where you're at, you know, like I'm really stressed because I'm dealing with, I don't have enough money to pay all my bills. Like something as simple as that, I think, is really informing to a lot of people. Or, you know, I'm really stressed out because I just had a baby and I'm not getting a lot of sleep right now, or whatever. You know, I think that the more that we can be open with people that we interact with, friends, family, coworkers, I think the better off that we'll be, and that will help everything else in general.
Yeah, you know, when we were talking about this, there was something I read and I saved some of this, right? So you talk about like toxic masculinity, you know, strength, power, affluence, you know, dominance. But what about like modern day, you know, which might be another good topic to hit on, which, you know, a lot of people are kind of saying like, oh, you know, a modern masculine man's, he shows great integrity. He's authentic, self-care. So those are all kind of the exact opposites, right? So self-care, that's been the topic of conversation tonight almost, you know, talking about your feelings, taking care of your health, providing, whether it's supporting a female in her role or being the provider, but also not in a way where you're just like, I'm the man, this is how it goes, my way or the highway. But I think those are all topics that you hit on, and just perceptions that I think are changing. But going back to talking about them, I think the more people talk about them, the better we are.
I think from my perspective, a woman, at least in a straight relationship, a heterosexual relationship, that women want their partners to talk about stuff. They don't want them to hold everything inside. And, you know, because that builds emotional intimacy, which then helps physical intimacy.
I think the more that we allow ourselves to be seen for who we are, without shame entering into that and keeping us from being authentic and, you know, living the life that we want to live, I think the more that promotes the ability to build trust with people and to build connection. And I think once we are able and we learn how to do that and care for ourselves and love ourselves, that will permeate, I think, into how we treat ourselves and taking care of ourselves physically, which also goes into all this other health stuff that we've already talked about. But thank you so much, everyone, for taking some time out to listen to this episode. Really appreciate it. I think it's an important topic. If you want to find any information about urology or men's health, or if you want to follow Brian, I'll put his information in the show notes. So feel free to check that out. But we'll see you next week.
Thanks, guys.
Thank you for joining us and peeling back the layers today. If you enjoyed this podcast and you'd like to support it, please share it with others, and please leave a review, like, subscribe, all that jazz. For more information about us, you can visit runionshavelayers.com, where you can find how to get connected with us and find resources mentioned in our episodes. Bye for now.